What if dialysis does not begin in a hospital? What if it begins quietly, years earlier? With high blood pressure you ignored. With blood sugar you did not control. With salty meals every night. With too little water. With too many sugary drinks. With painkillers taken casually. With kidney stones you thought were just bad luck. And with morning habits that slowly made your kidneys work harder than they needed to. Today, I am going to show you 8 natural drinks that may help support and protect your kidneys after 50. But before I show you drink number 8, let me tell you a story from Dallas, Texas. A man I will call Charles Bennett was 67 years old. Charles had always been strong. He worked for decades as a warehouse supervisor. He raised 3 children. He loved barbecue, sweet tea, canned soups, and late-night snacks. And like many men over 60, he did not like going to the doctor unless something was seriously wrong. But something was changing. Charles woke up tired. His ankles looked swollen by evening. His blood pressure was getting higher. His urine was darker some mornings. He had a history of kidney stones. His doctor had already warned him that his blood sugar was too high. And at his last checkup, his doctor said, "Your kidney numbers are not where I want them to be." Charles heard the words, but he did not feel sick enough to change. That is the dangerous part about kidney problems. Many people do not feel them early. There is no loud alarm, no sharp pain, no dramatic warning. The kidneys can lose function slowly and quietly. Charles kept drinking sweet tea. He kept drinking soda. He drank very little plain water. When he felt tired, he blamed age. When his legs swelled, he blamed standing. When his doctor mentioned creatinine and eGFR, he nodded politely but did not understand what those numbers meant. Then one morning, everything changed. Charles woke up with swelling around his eyes. His shoes felt tight. He stepped on the scale and saw he was 4 pounds heavier than earlier that week. He knew he had not gained 4 pounds of fat. That was fluid. His daughter drove him to the doctor. His blood pressure was high. His blood sugar was not controlled. His kidney labs were worse. And for the first time, Charles heard the word he feared most: dialysis. Not because he needed it that day, but because if he continued the same way, his doctor warned him that his kidneys could keep declining. Charles sat quietly in the car afterward. Then he said something his daughter never forgot. "I thought dialysis was something that happened suddenly. I didn't know I was walking toward it every day." That sentence is the reason this video matters. Most people do not destroy kidney health in one day. They do it through repeated pressure, high blood sugar, high sodium, poor hydration, processed food, smoking, obesity, certain medications, and ignoring test results. Charles did not need a miracle drink. He needed a safer routine. He worked with his doctor. He reduced sodium. He stopped drinking soda. He stopped sweet tea at night. He drank water more consistently. He monitored blood pressure. He asked about eGFR and urine albumin. He changed his meals. And when his doctor said certain drinks were safe for him, he added them carefully. Not all at once. Not as a cleanse. Not as a cure. One drink at a time. Used wisely. After several months, Charles felt different. Less swelling. More steady energy. Better blood pressure readings. Better control over his habits. His kidneys were not magically young again, but he had stopped attacking them every day. I am Dr. Adrian, and today, I want to show you 8 natural drinks that may support kidney health when used correctly. But please listen carefully. No drink can guarantee you will avoid dialysis. No juice can reverse kidney failure. No natural drink can replace your doctor, nephrologist, medication, blood pressure control, diabetes care, kidney dietitian, or lab tests. Your kidneys already cleanse your body. That is their job. So when I say cleanse and protect, I do not mean a fake detox miracle. I mean these drinks may help support hydration, reduce sugar-sweetened beverage intake, support blood pressure, provide antioxidants, support urinary tract health, or help reduce kidney stone risk in certain people. That is real support, not magic. And if you have chronic kidney disease, diabetes, heart failure, swelling, high potassium, high phosphorus, kidney stones, fluid restriction, dialysis, or take blood thinners, water pills, blood pressure medicine, lithium, or diabetes medication, ask your doctor before adding these drinks regularly, because natural drinks can still affect your body. Some contain potassium, some contain sugar, some can affect blood pressure, some can interact with medication, and some may not fit your kidney stage. Now let us begin with drink number 8, apple water or diluted apple juice. Notice I did not say drink a giant glass of apple juice every morning. That is important. Apple juice can contain sugar, even if it is natural, even if there is no added sugar. Fruit juice does not have the same fiber as whole fruit, and it can raise blood sugar quickly, especially in people with diabetes or prediabetes. So why mention apple at all? Because apples contain vitamin C, polyphenols, and pectin when you eat the whole fruit, and apple-infused water can be a gentle way to add flavor without turning your drink into a sugar bomb. If your normal drink is soda, sweet tea, or packaged juice, replacing it with apple-infused water is a major upgrade. Here is the safer way. Take a bottle of water, add thin slices of apple, add mint, maybe add a small squeeze of lemon, let it sit overnight in the refrigerator. In the morning, you get a naturally flavored drink without the sugar load of a full glass of juice. If you do use apple juice, choose 100% juice with no added sugar and dilute it heavily. For example, 1 part apple juice with 3 or 4 parts water, and keep the portion small. If you have diabetes, check your glucose response. If your blood sugar rises, apple juice is not your drink. Now, what about apple cider vinegar? Apple cider vinegar is popular online. Some people believe it helps blood sugar or kidney stones, but it must be used carefully. Never drink apple cider vinegar straight. It is acidic and can irritate the throat, stomach, and teeth. If your doctor says it is safe, start with 1 teaspoon in a large glass of water. Use a straw if needed. Rinse your mouth afterward. Avoid it if you have reflux, ulcers, gastroparesis, low potassium, kidney disease concerns, or if your clinician advises against it. The Dr. Adrian rule is simple. Use apple for flavor and habit replacement. Do not use apple juice as a sugar drink pretending to be kidney medicine. Drink number 7 is cranberry water or unsweetened cranberry juice. Cranberries are famous for urinary tract health, and there is a reason people talk about them. Cranberries contain compounds called proanthocyanidins, which may help reduce the ability of certain bacteria to stick to the urinary tract. This matters because urinary tract infections can be more serious in older adults, and if an infection travels upward toward the kidneys, it can become dangerous. But here is where many people make a mistake. They buy cranberry cocktail. Cranberry cocktail is often loaded with sugar. It may contain very little real cranberry, and if you have diabetes, that sugar can work against you. So choose carefully. Look for 100% unsweetened cranberry juice. It will taste tart, very tart. That is normal. Do not add sugar. Dilute it with water. A small amount is enough for most people. For example, 2 to 4 ounces of unsweetened cranberry juice diluted in water, not a giant glass. If you take blood thinners such as warfarin, ask your doctor before using cranberry regularly because cranberry may interact with certain medications. If you have a history of kidney stones, especially certain types, ask your clinician whether cranberry is right for you. The goal is not to drink cranberry all day. The goal is to use it wisely. Small portion, unsweetened, diluted, medication aware. Drink number 6 is beet juice. Beet juice is powerful because it contains natural nitrates. These nitrates can help the body produce nitric oxide, which supports blood vessel relaxation and circulation. Why does that matter for kidneys? Because blood pressure is one of the biggest threats to kidney health. High blood pressure damages the tiny blood vessels inside the kidneys. So anything that supports healthy blood pressure habits may indirectly protect kidney function. But beet juice also needs caution. Beets contain oxalates. If you have a history of kidney stones, especially calcium oxalate stones, you should ask your doctor or dietitian before drinking beet juice regularly. Beets can also contain potassium, which may matter if you have advanced kidney disease or high potassium. And beet juice can lower blood pressure in some people, so if you take blood pressure medication, monitor your numbers. To make it safer, start small. Do not drink a huge glass. Try 2 to 4 ounces diluted with water, cucumber juice, or lemon water. Use it earlier in the day, not right before bed. And do not panic if your urine or stool turns reddish after beet juice. This can happen from beet pigments and is often harmless. But if you see blood or are unsure, talk to your doctor. The Dr. Adrian rule for beet juice is this. It may support blood pressure and circulation, but it is not for everyone. Stone history and potassium status matter. Drink number 5 is lemon water. This is one of the simplest kidney support drinks. Fresh lemon juice contains citrate. Citrate can help reduce the risk of certain kidney stones, especially calcium-based stones, by making it harder for crystals to form and grow. This is why lemon water is often discussed in kidney stone prevention. But again, lemon water is not a cure. It will not dissolve every stone. It will not fix kidney failure. It is most useful as part of a hydration habit and stone prevention strategy. To make it, squeeze half a lemon into a cup of water. Warm or room temperature is fine. Drink it in the morning. Use a straw if you are concerned about tooth enamel. Rinse your mouth afterward. Avoid adding sugar or honey if you have diabetes or are trying to protect metabolic health. If lemon worsens reflux or stomach burning, dilute it more or avoid it. For many people, lemon water works because it makes water easier to drink, and drinking enough safe fluid can help reduce stone risk in many people. But if you have heart failure, advanced kidney disease, or fluid restriction, follow your doctor's fluid plan. Do not force water. Hydration must match your body. Drink number 4 is lime water. Lime is similar to lemon. It adds citrate. It adds flavor. It makes water more enjoyable. And it can help people replace soda, sweet tea, and sugary drinks. That replacement alone can protect the kidneys indirectly, because sugary drinks can worsen weight gain, blood sugar, and metabolic health. And diabetes and high blood pressure are 2 of the biggest causes of kidney disease. Lime water is simple. Squeeze fresh lime into water, add mint, add cucumber slices, drink it unsweetened. Do not turn it into sugary limeade. Do not add soda. Do not add syrup. If you want a refreshing afternoon drink, lime water with mint can be excellent. If your stomach is sensitive, dilute it. If you have reflux, be careful. If you have kidney stones, ask your doctor what type of stones you have because prevention depends on stone type. The Dr. Adrian rule is this. Lime water is useful when it helps you drink more water and less sugar. Drink number 3 is celery juice. Celery juice became popular as a wellness trend. But for kidney health, we must stay balanced. Celery contains water, antioxidants, and plant compounds. It is also low in calories and can be a refreshing vegetable drink. Some people like celery juice because it feels light and may help them reduce processed drinks. But celery juice is not a proven kidney cleanse. It does not replace treatment. It does not reverse kidney disease. It is simply a vegetable-based drink that may fit some healthy routines. There are cautions. Celery contains vitamin K, which may matter for people taking warfarin or other blood-thinning therapy. Celery can also be high in sodium compared with some vegetables, though far less than processed foods. If you have kidney disease, fluid restriction, or medication concerns, ask first. To make celery juice, wash celery well. Blend with water. Strain if desired. Add cucumber, lemon, or mint for taste. Start small, maybe half a cup. Do not drink large amounts daily just because the internet says it cleanses. If you dislike celery juice, do not force it. Kidney support is not punishment. There are other options. Drink number 2 is cucumber water or cucumber juice. Cucumber is mostly water. That is why it can be helpful. It makes hydration easier, it is refreshing, it is light, and it pairs well with lemon, lime, mint, and ginger. For many people, cucumber water is one of the safest drink upgrades because it helps replace sugary beverages without adding much sugar. But again, portion and medical condition matter. If you have fluid restriction, even cucumber water counts as fluid. If you have advanced kidney disease, always follow your fluid plan. To prepare cucumber water, slice cucumber into a bottle of water. Add mint. Add lemon or lime. Let it sit in the refrigerator. Drink throughout the day within your allowed fluid amount. If making cucumber juice, keep it unsweetened and fresh. Do not add sugar. Do not add fruit juice to make it sweet if you have diabetes. The Dr. Adrian rule is simple. Cucumber water is not a detox miracle. It is a hydration helper, and hydration support can matter. Drink number 1 is pineapple water or small diluted pineapple juice. Pineapple contains vitamin C and an enzyme mixture called bromelain. Bromelain is often discussed for inflammation support. Pineapple also tastes sweet and refreshing, but for kidney health, pineapple must be used carefully. Pineapple juice contains sugar. A full glass can raise blood glucose in people with diabetes, so do not drink large glasses of pineapple juice every day and call it kidney protection. That may backfire. A better approach is pineapple-infused water. Add a few small pineapple chunks to water. Add mint or ginger. Let it infuse. Or use a small amount of 100% pineapple juice diluted with water. For example, 2 ounces of juice mixed into a larger glass of water. If you have diabetes, check your glucose. If it spikes, avoid juice. If you have kidney disease, ask if pineapple fits your potassium and fluid goals. Pineapple is often lower in potassium than some fruits, but your personal labs still matter. Also, bromelain may have blood-thinning effects in some contexts, so if you take blood thinners or have surgery coming up, ask your doctor before using pineapple or bromelain supplements heavily. The Dr. Adrian rule is this. Use pineapple for flavor and occasional variety, not as a sugary daily drink. Now let us talk about kidney cleanse precautions, because this is where many people get hurt. They hear the word cleanse. They think more is better. More juice, more water, more herbs, more fasting, more detox powders, more extreme routines. But your kidneys do not need extreme cleansing. Your kidneys need steady protection. A harsh cleanse can cause dehydration, electrolyte imbalance, blood sugar problems, low blood pressure, medication interactions, or kidney stress, especially if you already have kidney disease. Some detox products may contain herbs or minerals that are unsafe for CKD patients. Some may contain potassium or phosphorus. Some may interact with medication. Some may act as diuretics. Some may not be tested for purity. That is why you should be careful. If you have kidney disease, heart disease, diabetes, high blood pressure, kidney stones, fluid restriction, or take prescription medications, do not begin a kidney cleanse without medical advice. Instead, focus on proven kidney protection. Control blood pressure, control blood sugar, reduce sodium, avoid smoking, maintain a healthy weight, stay active, use painkillers safely. Know your EGFR, know your creatinine, know your urine albumin. Follow your doctor's advice. That is how you protect kidneys. Now let us return to Charles from Dallas. Charles did not drink all 8 drinks every day. He built a routine. Morning, water with lemon. Lunch, cucumber water. A few times a week. Diluted cranberry juice. Sometimes, small beet juice because his doctor said it was okay, and his stone history did not make it risky. He stopped sweet tea. He stopped soda. He reduced salt. He monitored blood pressure. He walked after meals. He followed up with labs. That is why he improved. Not because juice saved him, Because the drinks helped him replace worse habits. That is the truth. The right drink is powerful when it removes the wrong drink. Now, here is a simple 7-day kidney drink reset. Day 1, replace soda or sweet tea with lemon water. Day 2, make cucumber mint water. Day 3, try diluted unsweetened cranberry juice if safe for your medications. Day 4, use lime water instead of packaged juice. Day 5, try apple-infused water instead of apple juice. Day 6, try a small diluted beet juice only if stone risk, potassium, and blood pressure allow it. Day 7, review your body. Less thirst, less sugar craving, better hydration, more stable energy. That is how you learn. Now here is the 30-day plan. Week 1, remove sugar drinks. No soda, no sweet tea, no energy drinks, no juice overload. Week 2, build hydration. Water, lemon water, cucumber water, lime water. Week 3, add targeted drinks carefully. Cranberry for urinary support, beet for blood pressure support if safe, pineapple water for flavor if blood sugar allows. Week 4, check your kidney risk. Ask your doctor, what is my eGFR? What is my creatinine? Do I have albumin in my urine? Is my potassium normal? Is my blood pressure controlled? Is my blood sugar controlled? Am I safe to drink these juices? Because kidney health should not be based on guessing. Now let us recap the 8 drinks. Apple-infused water or diluted apple juice. Use it for flavor, but avoid sugar overload. Cranberry water or unsweetened cranberry juice. Useful for urinary tract support, but watch sugar, stones, and blood thinners. Beet juice. May support blood pressure, but caution with kidney stones, potassium, and blood pressure medication. Lemon water. Simple hydration support and citrate for certain kidney stone risk. Lime water. Another citrate-rich hydration helper when unsweetened. Celery juice. A light vegetable drink, but not a proven cleanse and caution with blood thinners. Cucumber water. A refreshing hydration helper that can replace sugary drinks. Pineapple water or diluted pineapple juice. Flavor and vitamin C, but watch sugar and medication concerns. Now the final message. Avoiding dialysis is not about one miracle drink. It is about protecting kidney function before it is too late. It is about controlling blood pressure, controlling blood sugar, reducing sodium, drinking smarter, knowing your numbers, and working with your doctor early. Your kidneys do not ask for attention loudly. They work quietly. They serve quietly. They suffer quietly. So do not wait for a crisis to care for them. Start with one better drink, one better morning, one better blood pressure reading, one better lab test, one better conversation with your doctor. If this video helped you, share it with someone over 50 who drinks soda, sweet tea, or juice every day and never thinks about their kidneys. They may not need fear, they may need one smarter habit. This video is for educational and informational purposes only. It is not personal medical advice and does not replace your doctor, nephrologist, dietitian, pharmacist, or healthcare team. If you have chronic kidney disease, diabetes, heart disease, high blood pressure, kidney stones, swelling, high potassium, high phosphorus, fluid restriction, dialysis, or take prescription medications, speak with a qualified healthcare professional before adding juices, vinegar drinks, or natural kidney drinks regularly. I am Dr. Adrian. Take care of your kidneys. Take care of your numbers. And remember this, the best kidney cleanse is not an extreme detox. It is removing the daily habits that made your kidneys struggle in the first place.